Yeah, now the first thing I want to talk about is I want to talk about the kind of the almost aging natural thing that's going to happen, and that is that our prostate's likely to enlarge as we get older. The symptoms we most frequently recognize are I have to go to the bathroom a lot more often. And so, it's kind of the old man of, okay, or you're waking up a few different times during the night to go to the bathroom, and, then you're up again to go again, more often than you probably should be. Um, so let's talk about why the prostate enlarges and what we can or should do about that.
All right, let me start by describing a little bit of the anatomy of the prostate and its function. The prostate normally, up until the age of 50, is a walnut-sized organ, and it surrounds the tube going from the bladder to the outside of the body. That tube going through the penis is called the urethra, Urethra. And that tube is surrounded by the prostate like a donut, and the tube goes inside the donut. As men get older, for reasons not entirely understood, that prostate gland enlarges. And as it enlarges, it presses down on that tube that goes through the penis. As a result, the bladder has difficulty squeezing and getting the urine out, and now the man starts to have the symptoms. They start to dribble. The stream is not as strong as it was when they were younger. So a young man in his 20s or 30s can stand a foot or two away from the toilet or the
Don't
urine.
do that though. Your wife will hate you for it. So don't. Just stand close.
Yeah, or for sure, when you lift up the seat, put it down.
Yeah,
Yes,
both of
I am
those.
constantly reminded that I've got to put the seat down. So we have a decrease in the force of the stream, and we have to stand closer. We dribble after we're done, and so a man who's wearing khaki pants and he goes to the bathroom and he thinks he's done and he walks away and he'll have a little circle on his pants, reminding him that he wasn't quite done as he thought he was. So now we have the stream, and because the bladder is squeezing harder, it doesn't empty all of its contents. So imagine a gas tank, and the gas tank is always half full. So therefore, you don't have to put much more fluid in before you have to go again. So you go frequently. But the issue that really impacts men with this benign condition, it's not malignant, it's benign growth of the prostate, is getting up at night to urinate. If a man gets up once or twice a night, no big deal. When he starts getting up 4 or 5 times a night, he doesn't sleep as well. His sleep is interrupted. When he wakes up in the morning, he doesn't feel like he's got a good night's sleep. And it's the getting up at night that really impacts the man's quality of life. And often that's what sends him to the doctor for assistance. Most men over the age of 50 start to develop mild to moderate symptoms, and it doesn't impact their quality of life. And as a result, they tend to have, if it ain't broke, don't fix it, and they don't get help. However, the majority of men over the age of 60 and 70 have these symptoms, and it does affect their quality of life. And as a result, they do turn up to the doctor's office, and they often seek treatment. The treatment usually in the beginning is medication. There are drugs that are available that can shrink the prostate. There are drugs that can also open up and relax the muscles, but these drugs have side effects which include problems with ejaculation. So instead, when a man ejaculates, the bladder muscle squeezes and the fluid from the prostate goes outside the body. When you give those medication that relaxes the muscle, now when the man ejaculates, the fluid goes back into his bladder, doesn't hurt anything, and it comes out when he urinates. But most men like the fact that the fluid comes out when they ejaculate. It is important to them. Now there are when the medications don't work or the side effects are uncomfortable, there are now procedures that can be done, usually in the doctor's office, that can use lasers. They can use pins to tack the prostate up and widen the opening and decrease the resistance of the flow of urine. And so almost all men who have this problem can be helped. And the majority of it's very common, and the majority of men over the age of 60, 70, and 80 are going to have these symptoms that can significantly impact their quality of life. And the important thing I'd like to get across to our listeners is that it is treatable.